My presentation today is why I use a metallic lateralized reverse prothesis for 15 years ago. This is my disclosures. We know very well that the Grammont prothesis, you have a medialization on the lowering of center of rotation to increase the lever arm of the deltoid and to increase the tension of the deltoid fibers. So with Grammont prothesis, you restore active forward elevation. But there is a price to pay because there is no improvement of external rotation. Internal rotation is limited. We have a loss of shoulder contour and risk of instability of the prothesis. So in 2003, we decided to lateralize the prothesis, lateralize in the glenoid component and lateralize in the humerus. So there is 3 ways to lateralize in the glenoid component. We choose the metallic base plate. Mark Frankel decided to reproduce a 2/3 sphere with a center of rotation lateral, and Pascal Boileau used a bio-RSA to lateralize the center of rotation. So in these 3 ways, the center of rotation is outside the native glenoid scapula. You have to lateralize in the humerus if you modify the nape shaft angle between 155 to 135, if you modify the shape of the stem, or if you use an onless system or inless system, or if you medialize or lateralize the position of the polyethylene. So in 2003, we decided to do a metallic increase offset on the center of rotation in 8.5 millimeters of lateralization. We have a convex base plate and the glenosphere is putted over the base plate. So if you compare here the delta and you compare the arrow, you see that with the arrow, the center of rotation is lateralized, the humerus is lateralized if we compare to the delta. And if you lateralize the prothesis, you increase the deltoid tension to avoid instability, you decrease the risk of medial impingement, you tighten the remaining cuff to obtain better external rotation, and you recruit posterior fibers of the deltoid. So if you lateralize the center of rotation, you have to lateralize the humerus to maintain the lever arm of the deltoid and to restore active anterior elevation. Many experimental studies prove the benefits of the lateralization of the center of rotation, and Gutierrez proves that there is a correlation between the lateralization and the range of motion in abduction, and lateralization of the center of rotation is useful to avoid medial impingement. So Terrier proves that if you do a central rotation 10 millimeters outside the native bone, it is still safe. There is no difference regarding the strain around all the screw, better range of motion for bony RSA or metallic RSA. So Harman proves that if you put the center of rotation lateral 11 millimeters, the base plate is still stable. So we analyze a personal series of reverse prothesis with a metallic lateralization with more than 5 years follow-up. One center, one surgeon. It's between 2006 to 2011 with a minimum 5-year follow-up. We analyze 142 reverse shoulder arthroplasty and we study 85 reverse. You evaluate the range of motion and the pain, the concern score, and the degree of satisfaction. You understand that you lateralize in the stem, you lateralize on the humeral insert because we use a onless system, and you lateralize on the glenoid side. But if we compare with the Grammont is 13 millimeters, arrow is 34 millimeters. But you can modify with the size of the component, and the average is 21.2 millimeter. So this is epidemiology of this series, mainly female, more than 5 years follow-up. Primary cases in 72 cases and revision in 30 cases. So if you analyze the results, you see that you gain forward elevation, external rotation, constant score 58, and the value of the function of the shoulder is around 70. So 70% are good and excellent and were satisfied. This is an example. You see that there is an inferior tilt, the center of rotation is lateral, you reproduce an anatomic lateral offset with the stem, and we distalize the humeral stem. So the gain is in forward elevation, but also in internal rotation and external rotation. If you compare the result of primary cases and revision cases, you see that it's better, of course, after primary, and the difference is between 10 to 20 degrees. The value is 70, the value in revision is 60, and the constant score, there is 10 points of difference. So regarding the complications in this theory, primary cases is 60%, mechanical dissociation, polyethylene wear, humeral loosening, and more complication in revision, and instability, resorption, or allograft. The scapular notch with a lateralized prothesis is very low, is 4.7% with more than 5 follow-up. So if you discuss the glenoid lateralization, you know that the incidence of glenoid lateralization increase over the time and the clinical outcome decrease. And there is, if you use a lateralized reverse prothesis, there is no risk glenoid loosening in our theory. So regarding the humeral lateralization, if you decide to lateralize the glenoid component, you have to lateralize the humerus to maintain the deltoid moment arm. And it's clear that if you lateralize the prothesis, you increase external rotation, and the difference is 20 versus 10 degrees. So my first conclusion, with now 70 years of experience with a metallic offset increased lateralization in the base plate on humeral stem, we had no any glenoid loosening. We obtained better external rotation and internal rotation. We have a very low rate of scapular notching on polyethylene wear, and better stability on normal shoulder control. So if we compare with bone graft, we have many advantages of metallic lateralization. There is no risk of partial osteolysis. There is no glenoid notch versus 90% with bio-RSA. This is an easy technique. And we think that metallic is very useful when the glenohumeral joint is medialized. And I would show you a last case of example. You see that this is osteoarthritis with necrosis of the bone and medialization of the glenoid. If you use the metallic lateralization of the glenoid component, is not use bone graft, less bone graft, you restore a good lateral offset, retention of the cap deltoid, and you prevent instability. Thank you for your attention, and I invite you for the next year for the Paris International Shoulder Course in Paris in February. Thank you for your attention. Muchas gracias.